Revascularization of lower extremities. Revascularization is a critical procedure for restoring adequate blood flow to the lower extremities in patients suffering from peripheral arterial disease, PAD, or critical limb ischemia, CLI. It aims to prevent limb loss, relieve symptoms, and improve quality of life. This can be achieved through either surgical or endovascular methods, depending on the patient's condition, anatomy, and comorbidities. Indications for revascularization. 1. Critical limb ischemia, CLI. Rest pain not responding to conservative measures, non-healing ulcers or gangrene. 2. Severe intermittent claudication, when it significantly impairs daily activities and conservative management has failed. 3. Traumatic vascular injury, to restore perfusion in cases of arterial injury or occlusion. 4. Acute limb ischemia, sudden onset ischemia due to embolism or thrombosis. Goals of revascularization. 1. Restore arterial blood flow to the ischemic area. Salvage the affected limb and prevent amputation. Relieve symptoms such as pain and improve functional capacity. 4. Promote wound healing and recovery. Techniques of revascularization. 1. Endovascular revascularization. Minimally invasive procedures that restore blood flow using catheter-based techniques. Indications: patients unsuitable for open surgery due to high surgical risk. Focal, short segment stenosis or occlusions. Procedures: angioplasty, balloon dilatation. A balloon catheter is inflated at the stenotic site to dilate the artery. Stenting, placement of a stent to maintain arterial patency. Types include bare metal and drug-eluting stents. Atherectomy, removal of atherosclerotic plaques using a specialized catheter. Thrombolysis and thrombectomy. Thrombolysis involves administering clot-dissolving drugs, e.g. TPA, via a catheter. Thrombectomy uses devices to physically remove the thrombus. Advantages: minimally invasive with shorter recovery times. Can be performed under local anesthesia. Disadvantages: higher risk of restenosis compared to open surgery. Limited efficacy in long segment or heavily calcified lesions. 2. Surgical revascularization. Open surgical procedures used for extensive or complex arterial occlusions. Indications: long segment occlusions, failed endovascular interventions, patients with severe PAD or CLI. Procedures: endarterectomy, removal of atherosclerotic plaque from the arterial lumen, commonly used for femoral artery occlusions. Bypass grafting, construction of a bypass using autologous veins, e.g. great saphenous vein, or synthetic grafts, e.g. PTFE. Types: aortofemoral bypass, femoropopliteal bypass, femorotibial bypass. Advantages: durable results with lower rates of restenosis, effective for extensive or complex lesions. Disadvantages: higher perioperative morbidity and mortality. Longer recovery time compared to endovascular procedures. Preoperative considerations. 1. Imaging studies. Duplex ultrasound, non-invasive method to assess arterial flow. CT angiography, CTA, provides detailed arterial mapping. MR angiography, MRA, useful in patients with renal insufficiency. Digital subtraction angiography, DSA, gold standard for arterial visualization. 2. Risk stratification, assessment of comorbidities such as coronary artery disease, diabetes, and renal insufficiency. 3. Optimization of medical therapy, antiplatelet therapy, e.g. aspirin, clopidogrel. Statins for lipid control, blood sugar control in diabetic patients. Post-operative care and follow-up. 1. Medical therapy, lifelong antiplatelet therapy to prevent thrombosis, statins to prevent disease progression. 2. Monitoring, regular clinical evaluation for wound healing and symptom resolution. Duplex ultrasound or CTA to assess graft or stent patency. 3. Lifestyle modifications, smoking cessation, supervised exercise programs to improve collateral circulation. Complications of revascularization. 1. Endovascular procedures, restenosis or occlusion, vascular perforation, embolization of plaque material. 2. Surgical procedures, graft thrombosis or infection. Wound complications, cardiopulmonary complications in high-risk patients. Advances in revascularization. 1. Drug-eluting balloons, deliver anti-proliferative drugs to reduce restenosis. 2. Bioabsorbable stents, provide temporary scaffolding and dissolve over time. 3. Hybrid procedures, combination of surgical and endovascular approaches for complex cases. 4. Gene therapy and stem cells, emerging techniques to stimulate angiogenesis and improve limb perfusion. Conclusion. Revascularization of the lower extremities is a cornerstone in the management of PAD and CLI. The choice between endovascular and surgical techniques depends on lesion characteristics, patient comorbidities, and surgeon expertise. Advances in technology and techniques continue to improve outcomes, reduce complications, and enhance the quality of life for patients.